All right, let's get a move on then and talk a little bit more about what the outlook is on the weekly COVID cases in the second wave, as we are seeing a trend of a decline. Dr. A Velumani is the Chairman and CEO, Managing Director of Thyrocare Technologies, joining in. Dr. Velumani, while it may be a little bit premature, but what exactly are the trends indicating as we're stepping into the fag end of this month in terms of the COVID infection? Because it seems like the infections in many parts of the country and various different states are seemingly dropping. Can you paint a picture for us as to what the scenario looks like?
Good morning. I am also very happy to see the number of cases coming down countrywide from 400,000 a day to around 3.5 lakhs a day. I only hope this is not because of rapid antigen test excessively done, which can falsely bring down the number of cases. If that is ruled out, it is a happy news for the country. It is not for the city of Mumbai alone. It is for the country of India. That 400,000 was the peak, and we can expect it to come down to maybe early weeks of June. It should come down to as low as probably 40,000. So this is a positive happening. As I said, if it is not due to overusage of rapid antigen tests.
Mr. Velumani, good morning. Nikunj also joining us. Mr. Velumani, when you look at data, and one way of looking at data perhaps is how many tests you were conducting in big cities and where your presence is versus what is the demand for RT-PCR test. If the demand has come down, that clearly means that the wave is peaking out. So what has been your own experience in the cities where you currently are present?
The demand has come down compared to what was there in the early weeks of April, partly because a severe lockdown not allowing specimen movement that easily, a severe lockdown which has brought down the travel-related load very low. And according to me, the RT-PCR test then has come down in the country. But if I look at the nationwide number, it is substantially good, it is not truly less. So that means rapid antigen test probably is excessively used. According to me, there are some positive states like Goa, where it is 50+% is positive. Mumbai is only 10-12% positive. Delhi is 20% positive. So where Delhi and Mumbai were very, very bad shape a couple of weeks back, they have come back. So the trend is very clear. The positivity is coming down. But is it coming down as fast as the graph depicts? Or we have put some efforts to bring it down faster is something which I won't be able to tell. Only ICMR will be able to tell, looking at the percentage cases done rapid antigen test.
Another way of looking at the current wave is that there are a lot of resemblance of what we saw in the first wave, which is that it started with Maharashtra, then it peaked out in Mumbai, and then it was the same pattern which was there in rest of India. Are we likely to replicate what we did exactly in terms of the first wave, same time last year?
No, last wave, the first wave which happened in, let's call it peak that September 2020, was uniformly picking up in metro cities and then going to tier 2 towns. Here, it did not do so. When Mumbai was burning, Bangalore was cool, Kolkata was cool, then Delhi also was cool then. So it's going step by step to one city to another city. So according to me, the both patterns are not equally comparable. And the second one's spread was much, much faster than the first one. It's very difficult. In fact, I keep asking people, is it the second wave of the first stage or is it the first wave of the second stage? It's very difficult to compare until there are clear answers from sequencing telling that this is the second wave, second stage problem, and it is not the second wave of the first stage.
Mr. Velumani, while we always tend to focus on the testing and RT-PCR positivity reports, you also do a lot of other blood tests, which tell you that how the health of the patients have really moved during the entire, COVID situation. What is other data telling you? Is the second wave in terms of impact less than the first wave? Because you also have understanding of, how the blood markers they move.
See, today, if you see RT-PCR, the positivity is 400,000 compared to 100,000 of first peak. So you can call it as 1:4 is the RT-PCR test usage. But if I look at COVID-related blood markers, this is 4 or 5 of them are there. These markers, compared to the first peak, usage in the second peak is literally 25 times more, not just 4 times. Either the awareness of these markers have gone up, or the dependence on these markers has gone up, or this marker is really useful and people are using it, or because of the severity of the second wave, this has become necessity. Anything could be there, but it is very important to note in our today's revenues, the non-COVID is 40%, 30% only is RT-PCR, and another 30% is COVID-related blood infection markers, which was not existing in the first wave as clearly as we see here.
All right. Thanks for joining us, Dr. Velumani.